Hidden in the grounds of University College Dublin lies Ireland's premier veterinary hospital. Each year it sees some 6,000 animals, and for many this is their last hope to get better.
Oh, Kat, you better breathe.
Never before in our history have animals taken such a prominent role in people's lives.
He doesn't like men.
Okay.
And here, owners hope that cutting-edge technology and veterinary expertise can save the animal that they have grown to love and depend on.
All right, it's okay.
She's my life.
Seems to be trying really hard to get air into his lungs.
I know, sweetheart.
The ability to offer advanced surgical techniques, extend survival, improve quality of life for these patients, that's enough to get me up every day.
Let's go, yes.
Welcome to Animal Emergency.
Yes, good girl.
No.
Okay, don't worry. She's pooping. I had a feeling she needed to poop.
Oh, Jessie.
Don't worry. These things happen though.
Oh, Jess.
Making herself at home in the vet hospital reception is Old English sheepdog puppy Jessie and her mortified minder, Jean.
You're such a bold girl. Oh, be all right.
And she's a puppy.
She's a puppy, that's it.
Jessie is my son's dog, so I would be Jessie's granny, in other words.
So I'm so sorry, you poor thing.
Sorry, Pablo.
Oh, the bestest little girl in the whole wide world, aren't you? Yes.
You couldn't ask for a more lovable dog.
She's as gentle. She loves everybody.
There's no roughness in her. She's as gentle as they come.
Oh, you're so gorgeous. Oh, you're so gorgeous. Oh, definitely. Oh, you're so beautiful.
She's just beautiful.
Jessie! Hello! You look a little different.
Jessie's charm hasn't gone unnoticed by her vet Kevin, who has a particular soft spot for her.
We bonded very quickly, I have to say, myself and Jessie. She's a great personality. She's a great little doggy. Hello! Yay! Well, I actually live in a farm. So when I was quite small, I decided I was going to be a cow vet. Oh, she's put on a bit of weight too. That's good. Excellent. Come on. And it was only when I was in my 4th and final year of vet school that I decided, no, gosh, I really like the small animal end of things, and became a specialist then in internal medicine. What's up here? What's up here? What's up here? I put on a ridiculous voice when I'm talking to little puppies or dogs and cats. Yay! It's very scary. Nah. But I hope it makes them feel a little bit more at ease with me and a little bit more relaxed. And I think that's important. I think they need to be made feel secure as well. So it's 5 weeks now since we last had a chat. Medications, any problems getting them into her?
No problems. It's just we've run out.
Okay, so you've just run out. So Jessie came to us as a very, very sick dog without a diagnosis. She was close to death, I would say. She had pneumonia, aspiration pneumonia, but we weren't happy that that was the only thing that was wrong with little Jessie. Previously, she was bumping into things. Nothing like that, and she's very mentally alert. No problems.
Yes.
Okay. She was acting a little bit odd, and one of our nurses, Alicia, thought that she could be blind. I suppose our provisional diagnosis was this portosystemic shunt, and we think that was responsible for everything.
Yeah.
The ultrasound was very suggestive of an abnormal vessel in her liver. And this was what we call an intrahepatic shunt. So we'll do her CT scan today to better characterise that shunt.
Yes.
And decide, is there a surgical option or not? So this is an abnormal vessel that allows blood that the liver should process and clean in a way. It was allowing that blood to reach her systemic circulation. And then that means that this, in a way, dirty blood is reaching her brain, and that was what was causing her to appear blind and act so abnormal. And that could have been why, because she was so sick because of that, could have led to her aspiration pneumonia. So it sort of all made sense then. And I really hope that there will be.
I hope there will be too.
Yeah, I think
sorry,
it'll be.
you're going to be. Jessica.
That's how she gets her prey down, I see. So we shall do that for her today. Oh, bless her. Jessie, what are you doing? Yeah, she's definitely acting like a puppy again. Come on. Come on.
Come here.
I suppose the ultimate aim here is to diagnose exactly what kind of shunt she has, and then we'll decide if we can do something or not. We'll keep everything crossed. Right, and I shall have a little chat with you later.
Definitely.
Come on, then.
Thank you very much.
No
Karen.
problems,
Thank you
that's
so
absolutely
much.
fine. I'll talk to you soon.
Bye, girls.
See you soon. Come on.
Hello, we have Coco here.
For blood donation.
Yes, that's right, yeah.
Pop in and just take a seat
Yeah.
over here.
She's very loud, so...
Next to arrive at the vet hospital is Greta and her 4-year-old German Shepherd Coco. Greta answered a call to volunteer her dog to become a much-needed blood donor.
I thought, what happens if Coco in time to come is extremely sick and she needs a blood transfusion? If anything happened to her, I'd like to think that there would be someone out there who could, you know, bring their dog in.
Come here. Come here. I know.
Coco's personality, she's quite affectionate.
Okay.
Also, she is a very excited dog.
I know.
She is wired.
I'm so sorry to keep you waiting. My name is Monica. I'm one of the medics here.
She's not that keen on other dogs.
Right. We just need to get her weight on the scale.
She has a tendency to just not like them anywhere near her.
And then we're ready to go in. I just want to talk to you. Coco, that's not nice.
But she is the classic case of her bark is worse than her bite. So she looks very scary and intimidating, and she'll bark and bark and bark. And as you come closer to her, that gets smaller.
Hey.
It's like she doesn't know what to do.
All right, Coco, dig on.
Sit. Hey.
I could only imagine if I had told her that she was donating blood for dogs. She'd look at me saying, for real? They annoy me.
You can go in. Dig on.
Go sit. Okay, go on, see you later. Bye-bye. Go on, see you later. She's just wired.
I have no idea what he is because he has a really long body and little tiny legs and then a little head and little ears. Because my dad was always like, he's so ugly, he's cute. This is Pablo, my 14-year-old crossbreed that I found, I suppose, when I was 16. And he was very timid and afraid. And I don't know, my heart just went out for him. So I couldn't leave him. I couldn't leave him where he was. Oh, he was a devil. You couldn't. You just had to keep watching him all the time. He used to be really bad for if you left anything on the ground, he would cock his leg on it. That could be a jumper, it could be a picnic basket, it could be anything. He would have to investigate and put his mark on it, and you'd be left suffering the consequences. And he's actually, after aging very, very well, and he's calmed down an awful lot. But yeah, he's just an old boy now. I'm hopeful that he'll get another while yet, and I won't have to say goodbye. I couldn't love him any more than I do.
1, 2, 3. Oh, no. Come on.
That's probably sore. Oh, there we go, sweetheart.
Oh.
Okay.
Coco is a young and energetic German Shepherd. The team will have to prepare her to lie completely still in order for the blood donation to be successful.
They do have to receive a touch of sedation. Generally, it's a really low dose touch of sedation.
Good girl.
Well done.
He's a girl. Look at her.
What is going on?
And then generally, once we hit that vein and the blood starts flowing, everybody just has to be really calm and quiet for about 20 minutes.
Well done.
So we had a bit of shortage of blood at the moment because we had lots of animals recently that needed blood transfusions for anemic conditions. She was DA1 negative, so she was a good, suitable donor. Really? You did so good.
Coco's donation today was a success and a full bag of blood was collected. Her single donation will help up to 4 needy dogs.
You bit wobbly?
Hi, how are you? I'm picking Coco up.
No. Where are you going? Where are you going? Where are you going? This is like, that is fine. She's been fine.
I got very emotional afterwards, just because, you know, she'd done such a great thing, you know, and it does feel amazing.
She's actually very well behaved. It's just that she kind of moves around, doesn't she?
And I think this would give people a different idea about big dogs. They do have a very bad kind of stigma attached to them. They can't be trusted, and, you know, and there's me bringing in, you know, a German Shepherd, strong dog, after donating blood and coming out not a bother on her.
Thank you, guys.
No, chicken.
In the diagnostics department, 6-month-old puppy Jessie is getting a CT scan to try to understand the cause of her severe health decline.
This is the large abnormal vessel connecting into the portal vein, which is this.
So as we thought, and that's what we saw on the ultrasound. So this just confirms what we thought was going on. This is going to be a big procedure for this dog. So it'll have to be a planned surgery. We have to be very careful for the 1 week following that surgery as well, because they can develop lots of complications.
Hello.
Hi, Mrs. Redmond. It's Kevin here from UCD. How are you?
Not too bad. How are you, Kevin?
I'm good. Look, I'm just ringing to let you know, Jessie, she's absolutely fine after her procedure. She's all recovered in ICU, but there's definitely an intrahepatic shunt here. I've had a chat with team surgery here. They are confident that this is operable, but which is great. She's as bright as a button, so you have nothing to worry about. I don't expect or foresee any problems overnight. All right, no problems at all. I'll talk to you soon.
I'll talk to you soon.
Okay, bye-bye. Bye-bye.
Bye.
Kevin wants Jessie to go home and get stronger before scheduling her for what is going to be major surgery. Bringing up the rear on a walk with her family is ageing mixed breed Jessica with Alan, Emma and their twins Lily and Rosie.
We were together for a long time, and it came to that kind of period in our life when we decided to settle down and we wanted to have children. And being kind of, as people in the 90s were, kind of, we stayed at the party very long, and it took longer than we were hoping for. So we went into IVF, and it was quite stressful. It's quite a roller coaster. And it wasn't so much because of the stress of the IVF. I just thought it would be good preparation for having children. We wanted a small dog, first of all, because we live in an apartment. And we wanted to have a dog that was fairly placid. So we did want to have a Shih Tzu, but we hadn't really asked for a Jack Russell. She just came that way. She's 13 now, so she's an old girl now.
She does a little trot and then she might slow down a little bit and then she trots on again. It's just, she might be a little sore.
Well, she has the willpower of a Jack Russell, which is basically you have to watch out while you're training them because they train you faster than you train them. But she's also very, very placid. So once she realised that the pack had gotten bigger for her, she basically understood that these were vulnerable and they needed to be protected. She'd lie down with them and her maternal side came out. At one stage she'd be trying to find something of hers under the couch and they'd come along and pick her up by her tail and she would just look at us as to say, are you going to let this happen? So she was a perfect family pet.
Yeah, Jessica.
13-year-old Jessica is a familiar face at the vet hospital.
Off to see Maria and Pedro.
She suffers from a rare and serious kidney condition in which the protein levels in her urine can become dangerously high.
Hello, Mr. Kelly.
Hi, Pedro.
How are you?
Good.
Hey, Jessica. You're
She
shivering
seems-
already.
Yeah, she seems to be a little apprehensive.
Vet Pedro monitors and tries to lower Jessica's protein levels with medication, but the illness is incurable and treatment options are limited.
She's losing loads of proteins through her urine. We found that she is affected by a disease that is called renal amyloidosis. Unfortunately, this disease is characterized with a very poor outcome and poor response to treatment. We don't have an effective medical management for them, so there is no medication that will resolve her disease. So at the moment we just need to go through keeping her as comfortable as we can and getting her good quality of life for as long as we can, given her disease. Today we'll get her in. I'm going to reassess her whole physical condition. After that we will see how is the bloods. We'll repeat how are the kidney parameters doing. We'll check again the urine. I saw you brought the samples.
And I have, it wouldn't be full-blown depression, but I have depressiveness, and like my first waking thought in the morning would be an expletive. And when the very first thing you do in the morning is you respond to a little puppy running up the duvet and with their wet nose kind of licking you on the forehead, and you just burst out laughing. So like that itself has to be a huge kind of help to anybody.
That's Jessica, isn't it?
Yeah, it's Jessica.
Jessica, we're admiring the hairstyle of Jessica.
She likes to be admired.
And Pedro's hairstyle as well.
Yeah.
Well, you're disappointed really because you really want her to last longer, but it's you know, it's the process of life.
Good care, Jessica. Okay. We are trying to control the levels of proteins within the urine, which is giving us a bit of a hard work, but we'll hope that will at least slow down like the speed of losing of proteins. Her kidney disease seems to be stable at the moment, and she's so far enjoying her life. Good girl, Jessica. See? I know you don't like this. The life expectancy is very short, so they're based on 30 to 90 days in many occasions. We already we're close to those 90 days. She's not having signs that she will deteriorate very quickly, so hopefully we can go above that. She's not responding much to medication, unfortunately, so she's coping though.
Jessie, what happened? Was it dreadful? Did it treat you very bad?
In an effort to improve the quality of Jessica's life for her remaining days, she sees her pal, physiotherapist Maria, who works to ease her chronic arthritis.
But look, Jessica, look what I have. What is it? What is it that I have? Huh? Are you gonna sit? Jessie, sit. I say, no, Maria, I don't do sitting. I don't. I do whatever I like. We are very attached to our patients. I definitely am. Can we just have a feel? Better feel? Oh, my little darling. Give me just one more second. One more second. I'm not here only for the science. I love it. I'm very curious about physio and all that, but I'm here because I love the contact with the animals because they give me so much. It's pure selfishness. Good girl. I know that's a bit sore there. Give me 10 minutes, okay?
Hiya.
And also he's operated like and it was stable, so I don't think it's painful.
Hello.
Hello.
Who's there?
Hiya.
It's Tabby.
How you doing? Who's a good girl? Oh, who's a good girl?
Hey, what is happening, Jessica? What you went down?
Oh yeah, she's that's an improvement in her walk.
Yeah,
absolutely.
definitely. Maria,
and she's sparky as well.
Yeah, so Maria has been working with her for almost an hour. Yeah. She led her to work on the legs, and she was happy how everything was getting afterwards.
And blood pressure is okay?
Yeah, the blood pressure is much better.
Look at that, she's smiling away.
Yeah, she's so lovely.
Hiya. That's great. It's good to see her in that mood.
I'm very grateful for all that she's kind of given our family. So I'm kind of in the mode that I want to do whatever it takes, that she has the best medical treatment, that she has the most comfortable exit. It'd be nice if she was able to have no pain and die at home. So I don't really want to put her down, but on the other hand, I won't allow her to have a bad quality of life, and I don't want her to have a painful exit. So we'll have to cross that path when we come to it.
See you then. Yeah. There you go, Jessica. Good girl, good girl.
Poor Jessie. Oh, the poor pet.
6-month-old puppy Jessie was due into the hospital in a week's time for surgery to stop a condition that allows dirty, unfiltered blood into her vital organs. However, Nan Jean, who is herself a nurse, spotted a worrying deterioration and has rushed her in.
On the Monday, I brought her for a walk with my granddaughter. When we got back, she just flopped, and I just thought that was odd. But she's not eating right, she's lethargic again, she's not able to move, she's listless.
Okay, so just have a look at Jessie, okay? The medical management is not working. It is true that we always like to get them as stable as possible, as strong as possible for them to go into surgery, but then it's not working. So I think we need to take the risk, and even if she's not the strongest one, she needs to go through. And you understand the risk that we are having, but if we don't do the surgery, she won't survive. She won't survive.
What she needed was to have her surgery, and we were trying to build her up and make sure she was as safe as she possibly could be for the general anaesthesia and surgery. But unfortunately, she deteriorated a little bit just prior to her surgery.
What a good girl. Oh, so good.
There are always patients that, you know, we get very close to as well, and we sort of see them as part of our family as well. And when things don't go the way we would want or planned, it's very distressing, and it's distressing for that little dog's family as well as for us.
The background that I have, I worked in theatre, so I know how delicate it can be. I know how easy things can go wrong. Her bloods wouldn't have been great, so it's all about looking about how strong her heart was. And that's, I suppose, was my worry. Would it be strong enough to go through all of that? Would it be strong enough to heal? Would she be strong enough to be able to come out of it? If this doesn't work, there's no B plan.
There's the soft spot right there. There
exactly.
it is.
There
it is.
Right
Right before the cava. Yeah. So avoid that like the plague.
Mary Pauline will be taking on this huge responsibility as lead surgeon today.
Jessie's, so we call it shunt, so that's the vessel. That vessel was embedded into the liver, so it can be very, very challenging to find and also very challenging to dissect.
I go slowly, I just don't want to traumatize tissue too much, so I go slowly there.
Go slow.
Sharp. On that arm.
Here?
On that arm, yeah. Thank you.
Be careful now, because this is a very delicate vessel. As it starts to balloon, it's just like one cell layer thick.
I'm not even...
These vessels are so friable that by trying to dissect them, you have higher risk of hemorrhage.
Okay, so I'm going to dissect more here.
Yeah, so be really, really careful now.
Yeah, that's good with you.
Okay, let's get some suction down in there. She's got flow going on the right side.
Despite the team's best efforts, their biggest fear going into the operation has become a reality.
She had bled intraoperatively.
Under my vessel root, so see if you can see where that bleed is.
Maybe there.
Yep, okay, it's big enough you're going to need a clamp or something on it.
Give me the portal.
Yep.
Because the dog is going to die hemorrhage. To give you a window, go for it there now.
Here's a vascular clamp.
Rosie, what's she doing? What's she doing, Rosie? Daisy? What you doing, puppy?
So we got Rosie there 3.5 years ago. So we got her as a puppy, and we decided fairly quickly that we loved having a dog. And we got Daisy then at that point. So there's only a month between them. Daisy, what's up with you? Why can't you be more like your nice, quiet sister?
Do you have a favourite with your two dogs, would you say?
Oh, it's probably Daisy. I shouldn't say that. Poor Rosie. Rosie's a good girl. Daisy's a pure devil, but you know the way you love the devil. Daisy? No. Daisy? No. Get out of the dishwasher. Daisy, out of the bin. No. And Daisy's more cuddly than Rosie. Rosie's more independent, and she'll come over and she'll lie on your legs or whatever, but she'll not come up and lie there like a baby with me like Daisy would, you know. So I love cuddling with Daisy and that, so it's probably her. No, I have kids as well. I have 2 sons. Yeah, 12 and 15. They're not into the cuddles as much anymore now, no. They really are part of the family. It's like I have 4 children instead of 2.
Hi, are you Daisy's owner? Yes. Perfect. Can I just check your details very quickly?
Yeah, sure, lady.
Amazing. She's a pug beagle cross.
She is.
Oh.
Deirdre and Daisy are arriving into the vet hospital today for investigations after a worrying episode at home in Leitrim.
Hi, Daisy. Oh, you are gorgeous.
During, we'll say, the first lockdown, she had her first seizure.
It's okay, Daisy. It's okay. Daisy, it's okay.
She just fell over and started convulsing and salivating at the mouth, and it was very scary. She was kind of paddling her legs, and my elder son was with me at the time. It was quite upsetting. I was absolutely in bits now. I was just crying my eyes out.
Oh, she's gorgeous. I love her.
Me too. Don't tell my children, but she's my favourite child.
It's not something you ever want to see an animal you love going through.
Daisy's local vets diagnosed epilepsy, and medication seemed to make a difference. But recently, Daisy had a cluster of 6 seizures in one day, and Deirdre is worried something else is going on.
Miss Malone, hello, I'm so sorry. Daisy's mum.
Yes,
I'm
how are you?
so sorry to keep you waiting.
You're okay.
My name is Monica, I'm one of the medics.
Hi, Monica.
So until June, she was never had a problem before?
Never had a problem, no.
And they've been pretty consistent since the beginning?
Pretty consistent since the beginning. The only blip was that last time where she had 6 in 18 hours. Yeah,
exactly.
Other than that, it was always some point of stress or point of excitement, and you could pinpoint exactly what was going on.
Okay.
But that was the only time.
Her age and the presentation probably would fit with having idiopathic epilepsy, the same as people. It is an exclusion diagnosis, so we would rule other causes out first. So we will do comprehensive bloods just to make sure that we rule things out completely. Okay. She would need an MRI.
Yeah.
What we would do at the same time, normally as we would do the MRI, would be to get a little fluid tap of the spinal fluid.
Okay.
Just to see if there's any inflammation or anything that may have not been highlighted on the MRI. When she gets stressed and anxious is when she usually seizures, isn't it?
Yes.
I worry that she will seize because it's a pattern with her. She does not like veterinary practices.
Some dogs, unfortunately, can seizure after the spinal tap.
Okay.
But if it is the case, obviously we'll be able to do something.
Yeah. I hate to think of another period where she's going to have clusters of seizures while a medication is going out of her system or anything like that. I would worry about that.
She won't be able probably to go home this evening.
No,
I would imagine.
We have a hotel booked for tonight.
Okay, I was going to say.
Yeah.
But I suppose she's in the best place if she does. And I'm just really looking forward to getting her home again.
Hopefully we can get the MRI and the rest of the procedures done tomorrow.
Okay.
As long as she recovers and she's not had any complications and there's no problems, she should be able to go home.
Oh, that's great. Good girl.
Joe, how are you?
Hi, Alicia, is it? Hi, darling, you well?
How are you? Okay, Joe, we're going to bring you over here to this fancy table.
Okay. This is my 3rd guide out there. I went blind about 25 years ago in an accident, and my cane work would be quite slow and deliberate. Like going there without us to the bus stop takes 5 minutes or less. Whereas if I go in there with the white stick on my own, it's 25 minutes of intense concentration. It takes about 4, 5 or 6 months before you're fully up to speed with the dog. And there were times where I would have thought the dog had taken a left turn where we shouldn't have. And invariably I was proved wrong. The dog was right and I was wrong. All my previous dogs, I've held on to them after they retired.
And will you do the same with Otis?
Definitely, yeah. He's too many secrets to tell.
Old English sheepdog puppy Jessie is undergoing life-saving shunt surgery. But there's a problem. The tiny vessel has punctured and she has started to hemorrhage. The team will need to stem the flow fast.
It was a no-brainer. It was either we stop it and we try to close the bleeding or we lose the dog.
Can you see the hole itself?
Trying to see it.
We could stop at least the blood going through the vessel to be able to see the hole.
There it is. See?
Yeah, I see it.
But during that time, you're stopping the circulation, so the organs are really struggling if you stop the blood circulation for too long. So you kind of have to be fast.
One more and you've got it. You just do a cruciate, a purse string.
Yeah, this was challenging, but again, we knew it could happen. We knew what to do in this case.
You need to pull. Okay, you ready? Okay, down you go.
And I just closed the hole with a small filament.
Release the portal. Okay. Release the portal. That's a good job. Okay. Yeah, good.
Okay.
We passed the risk of bleeding. We're happy. We had it under control.
That's nice there now.
That's nice. Yeah, beautiful.
And I was relieved that we could find the shunt and place that suture around it.
Yep, good. That was a beautiful dissection that Marie-Pauline did. You know, as much as that CT angiography is really, really useful, it still doesn't necessarily correlate with exactly what we're seeing at surgery.
Jessie went directly to ICU. But after that, there's also other complications that can happen, even 24, 48 hours post-surgery.
Hello.
In the vet hospital's treatment room, Monica and nurse Kieran are taking bloods from Daisy to try and diagnose what's causing her seizures.
She's afraid of the vet and she's afraid of just being away from home, I suppose, and fear seems to set her off.
They are hoping the stress of the process itself doesn't bring one on.
Daisy?
2 seconds.
So it'll be done in a second. So we have things that could potentially affect the brain but are systemic problems. Good girl. So any problems with somewhere else in the body that will affect the brain. So she ended up having some general bloods done to rule out all the extracranial causes first.
Yeah, just put your little bandana back on you.
All of those tests were normal. And then we're left with an intracranial disease. So it's just really brain related. One of the potentially differentials for seizures would be having a brain tumor. So that's why she ended up having the MRI. And just to be 100% thorough and that we would rule out having no inflammatory disease, they usually get a spinal tap done together. So a spinal fluid analysis to rule out there was definitely no inflammatory component to a seizure activity as well.
Nice.
That's right. Okay, let's go.
That sounds like a funny thing to say. I hope it's epilepsy, because that's controllable by medication.
Are you waking up?
And I'm hoping that there's nothing more sinister and that we can just kind of go on and keep managing it with medication, and she can go on to just live a long life and cause all the trouble in the house. I'd hate to lose her. There'd be no talking to me, I'll be in bits. Yeah.
In County Laois, meet farmer Mick. He breeds cattle and he's quite particular about which ones he prefers.
I always had a great love for the Limousin cattle, and I always liked them preference over any other breed.
It's very much a family business, with all hands on deck.
3 daughters is a small workforce, and the wife looks after the most complicated part of the whole thing, the paper side of things, so that's the way it rolls.
The family are enthusiastic about bringing their cattle to agricultural shows nationwide.
We do maybe 8-10 agricultural shows a year, the local ones around, and then we always go to the national finals, which will be held in Tullamore every year.
2-year-old heifer Mary holds a special place in Mick's heart.
We knew as a calf coming through down along she was going to be a special one, and she was very good for us, and she had great style and great flair and great show presence about her. So she's actually probably one of the best heifers in the yard in relation to breeding genetically for us.
Losing a valuable young breeding heifer like Mary would be a devastating blow to Mick and his family. That has become a real possibility now, as she has developed a dangerous infection on her leg, which the surgical team will attempt to remove today.
They gave me the diagnosis of the operation, and they just said to me, Mick, if she doesn't have the surgery, she's not going to make it, and if she does have the surgery, there's a 60-40 hope of success rate. There was no other way out. The surgery had to go.
Today the team will be operating on the infected area of Mary's leg, known as the hock joint.
The hock joint is the equivalent of actually of your ankle, but compared to a human, like a horse or a cow, the hock joint is it looks like it's halfway up the leg. It's very, very important for mobility. There's a lot of weight going through it. In an animal that age, it's much more likely that it's traumatic in origin. So she just got a bang and something penetrated the skin in that area of the hock, allowing bacteria to get into the joint. And when infection does get in, then it can involve bone, it can involve 2-3 joints, and it can be difficult to get on top of.
Let's put the vaporizer.
In a hospital environment like this, we do actually have specialist anaesthetists. We have the ability to put the animals on oxygen and gaseous anaesthesia. That decreases the risk a lot.
So I'm going to go medial, aren't I? So I'm going to go in that bulge there, I think. Okay.
The arthroscopic equipment that we use, it's a small little scope, and it goes through just about a centimetre skin incision and a small little stab through incision into the joint capsule.
Table down, please.
And that allows a very minimally invasive procedure to occur. So it's a little camera on a long handle, and the camera goes in and you distend the joint up with fluid, and you can have a really good visualization of the area, and then you create a second, what we call an instrument portal, where we can put in an instrument to either probe or to take out nasty material, or sometimes we get fragments that we need to remove, and we would take out fragments of bone or cartilage.
Over here, up. There we go.
So after the removal of all of these blood clots and pannus, we use large amounts of saline, and that basically flushes out as much as possible.
That's okay for the moment.
At the end, we also tend to inject some antibiotic into the joint itself after it's actually been sutured up.
It's under an hour since the completion of surgery. The success of the procedure will begin to become clear if she makes it back to her feet in good time. Also, the team is hoping she won't act out in distress and cause new damage to her vulnerable leg.
There are some cases, if the temperament of the animal isn't right, that they're so wild and they're going to be jumping and everything, it's going to be so hard to manage them post-operatively, because you could wake the animal up and then they just go jumping around and break everything down straight away.
So she's up in good time, so she's holding herself well, and there's no sign of myopathy, so that's a good thing.
To be honest, I would have been devastated. You see, you might just get maybe 1 or 2 or 3 special ones like that maybe in a lifetime coming through.
It's a happy day for battle-weary Jessie. After major surgery, she's ready to go home.
A human person would probably stay in ICU for a month, and a week later, and actually today, I'm sending her home. So it's incredible. They can lose a lot of blood, but they are very, very strong, I would say.
Jessie, darling, how are you? Oh, my little hello. Look at you. Look at you. Look at you. Oh, my God.
This little girl is a survivor. There's more strength, courage, determination in that little bones than a lot of people have. I think she's just kind of go, no, I'm living, that's it. I know I'm going to be treated as a princess for the rest of my life, so I'm living.
How are you? Oh, my God. Yes, I know. Tell me all about it. Tell Mammy all about it, come on.
I think Jessie's outlook looks very good. The fact that our surgeons here were able to deal with this intrahepatic shunt means that she could potentially have a normal life.
Thank you. I know, we're going home, I promise you. We're going home. Now.
I'll spoil her rotten. I just think this girl deserves every good thing in her life because she's gone through so much. So much.
Come on now, darling, in you get. Here we go. Now. Perfect. Yeah, will do. Thank you.
Deirdre is here to collect her beloved puggle Daisy, who has been watched carefully overnight.
Whose writing is that? Who's
That's mine, sorry.
Jesus, you're deplorable. Emma.
Worse than yours.
I have deplorable writing. Yours is shocking. Shocking.
And she was moved to ICU for monitoring more closely in case she did seizure.
Here we go.
Now, with a definite diagnosis for Daisy, Monica has the enjoyable task of reuniting Deirdre with her precious doggy.
Hello. Where are you going? Oh, gorgeous. Oh, my goodness. Oh, my goodness. Hi, Diddy Goose.
Daisy was actually a stellar patient. She was really, really good. Believing it or not, she never had a seizure through the whole 2 days that she was here.
I'm really shocked at that, I have to say. Hello, that's better that way. It is, yeah.
That is okay.
A lovely little bald spot.
I know. It's not a big cut, hey? You got
No.
just a tiny hair shave.
Have to make her wear a Santa hat or something
Yeah,
like that.
exactly. You will grow back, won't it?
Yes, it will.
We'll
Yes.
disguise it. She woke up really well.
Yes.
There was no complications.
Okay.
So all the tests so far have been fine. So the MRI was completely normal. So it had no abnormalities at all.
That's great.
And very subjectively, the fluid looked completely clean as well. So it doesn't seem to be opaque.
So it
doesn't
looks
have
to
any-
be epilepsy, basically.
Yeah, exactly.
Great.
They do well as long as they remain on medication. Some dogs can come off medication after a few years, but normally we would be considering that will be a lifelong treatment.
Thank you so much. You ready? You ready? So happy to get her home. Oh my goodness.
And the medication may need to be adjusted, new medications might need to be added, but generally they tend to do well. I know, Mummy's been here in Dublin for 2 days now.
Walking past, every time you see a dog walking past, you're like, oh, I miss Daisy.
Oh, so she's ready to go. You ready to go?
Thank you so
Thanks
much.
very much. Take care. Bye-bye.
Bye-bye now. No, thank you. Bye.
All the best. Oh, she's a gorgeous dog.
She's very cute.
Come on. Come on.
That's how she gets her prey down, I see.
She's in calf, she's going well, so prognosis is pretty good.